The chairperson of the Portfolio Committee on Health has expressed concern regarding the alarming reported incidents of violence that occurred recently at healthcare facilities in Mpumalanga. Joining us to discuss the apparent security issues is chairperson of the Portfolio Committee, Dr. Sibongiseni Dhlomo. Good evening, Doctor. Thank you very much for joining us on the SABC. Doctor, the incidents in Mpumalanga, specifically the Temba Hospital in Mpumalanga, have been on the rise. Not so long ago, we reported on a business forum that attacked doctors, and this was a matter related to contracts at the hospital. And now this most recent one, and very shocking, being that of the businessman who arrived with armed bodyguards assaulting staff, demanding preferential treatment. Now, we understand that you've been briefed by the MEC for Health there, Sasekani Manzini. What did she have to share about this incident?
Good evening, ma'am, and good evening to your listeners and viewers. I actually was very happy with the report that the MEC for Health in the province, Sasekani Manzini, gave us regarding this very concerning incident that on the 9th of August, somebody coming in there, probably thinking that because I'm such an important business person, I have someone who must be attended to, and everything else in the hospital must come to a standstill. And if you don't follow those instructions as I come in, then look what I'm carrying, what I have. Now, we do not accept that because the security and the safety of our staff, including patients, because it could have been a threat even to a patient, is of paramount concern for the department. And therefore, whatever they put in place, like there must be someone who declares at the gate that I have a gun, and it could always be asked to leave it there. But when these ones willy-nilly gets into the premises of hospitals carrying their guns, not even hiding them and demanding some preferential treatment at the expense of, and if you don't, and doctors, nurses are threatened, it's something unbecoming. We really condemn that very strongly. And we actually say we need to do everything. And we can't rely on SAPS must pull out from doing SAPS work in the country and go and guard these types of people who come to our hospitals with this thing. So it is actually us who must stand up as a community to say we shall not dispose. The government has put in place, but somebody just bypasses and ignores the security at the gate who asking, do you have a gun to declare? They say we don't have, and then they come and cause havoc in our hospital.
But what did the MEC have to share around the glaring security lapses here? Because one would assume beyond just having to declare verbally, there would be a detector to detect if anybody is carrying a gun.
We don't have that system as yet, ma'am, in the country. And maybe it's an expense that we probably must consider to say, other than to ask this person in front of you, do you or do you not have a gun to declare? We probably need to get them searched now. Either maybe start with the body search, and if that is not also helpful, consider getting into the expenses of getting these detectors.
But Dr. Dhlomo, pardon me for interjecting there, the ordinary metal detector, the one that many would have in their places of employment, that's the one I'm talking about, including that measure of just checking. It happens at several restaurants, it happens at shops. So body searches and the usual detector where if you've got a laptop, it will just go through and it will indicate what's inside your laptop bag, or if you have... Yes, so
I agree.
The ordinary one, they wouldn't have, or just that process of body searches for males and females.
I think that is something that must be strengthened, and we need to actually make sure it happens. You are correct. Just those machines that you can just body search with a person, that they detect any of that metal. It has to. I did not get that impression that it was actually religiously done at that place.
Oh, but then that would be a serious security breach. And the reality is that, Dr. Dhlomo, this has a ripple effect on the community. When doctors feel as though their lives are not being protected, they'll leave, and no doctor will agree to be deployed at Temba Hospital. Then the community of Mpumalanga suffers. Most certainly, one would think they would be held accountable for that aspect, that if you're not even conducting body searches, what are we doing?
Not only will that threaten Kwapokweni Temba Hospital, if people will come to know that we are not doing our job religiously so and do body searches, not only in Temba but any other place, then we are vulnerable. Everywhere else they will come and do what they did in Temba Hospital. So you are correct. Those are things we need to look into and make sure, and that was actually engaging. So there will be a follow-up report with the MEC. Are they strengthening that part or not? Because it is a concern, you are right. People will vote with their feet, and doctors, nurses stop coming to our facilities and go elsewhere because they think they are not safe.
And then there's also the aspect of contracts. Not so long ago, as I stated in the intro, there was a business forum that came there, harassed the doctors, speaking about contracts that were being awarded to either close friends of some of the staff members at the hospital. Have you received an investigation on that or some sort of a report?
I do notice that that is an ongoing process of actually people coming to threaten. It's not only happening in Temba Hospital and maybe in Mpumalanga. It's a countrywide program where people feel that they are entitled to this, that, and the other, because this is to that. I am actually aware that the Department of Infrastructure and Public Works, the SAPS, and affected departments, health being one of them, are actually putting their heads in place. And we really want to welcome that and actually be appraised of the process, because it is just many departments that must actually be seized with this type of a scenario. But we continue to condemn this type of a behavior because it actually is threatening even the economy of the country. When we have to start building that bridge, that clinic and hospital, it has to stop because we are negotiating with the people who are actually coming into those facilities. So that is something that also is seized with the department's concerned to work on it. But from the portfolio committee, I'm reporting tomorrow the progress. I would await that they actually put things in place to make sure the body searches continue religiously so, and everybody else who comes in violently so can then be stopped at our gates.
Doctor, I'm sure the community of Kwapokweni will be quite heartened by the fact that you have demanded some level of accountability on the part of the hospital, even the department, insofar as the security issues are concerned. Thank you very much for joining us.